हाय एवरीवन, वेलकम टू आवर फैम हेल्थ स्पेशल। आज हमारे साथ जो एक्सपर्ट जुड़े हैं वो एक सीनियर पल्मोनोलॉजिस्ट हैं अमेरिका में। कई महीनों से हमारी यही कोशिश है कि हम तरह तरह के एक्सपर्ट्स को आप तक लेकर आएं। इस बार हमने सोचा कि देखते हैं कि अमेरिका जहां सबसे ज़्यादा कोविड केसेस हैं वो कोविड को कैसे हैंडल कर रहा है, किस तरह के पेशेंट्स आ रहे हैं, किस तरह की ट्रीटमेंट दी जा रही है। इसीलिए हमने इनवाइट किया है हमारे स्पेशल गेस्ट को, जो हैं डॉक्टर अमित गुलाटिया। ये एक सीनियर पल्मोनोलॉजिस्ट हैं पिट्सबर्ग पेंसिल्वेनिया में। सर, welcome to Fam Health Special and thanks a lot for taking out the time to talk to us. Please give us a brief introduction about yourself.
I am Amit Goulatia. I'm a pulmonary critical care sleep medicine specialist in Pittsburg, Pennsylvania, working at UPMC and AHN Health Systems.
Thanks a lot, sir, for that introduction. सर, अगर हम पेंसिल्वेनिया की बात करें, जिस स्टेट में आप प्रैक्टिस करते हैं, वहाँ इस वक्त कोविड का क्या सीन है? What is the scenario? How good is it? How bad is it? Can we expect a flattening of the curve? Please share your observations with us.
We were fortunate that our state was shut down earlier than most of the other states, and we really didn't see a surge as bad as other states like New York or the eastern side of Pennsylvania. So we were taking care of only about 10-15 patients in the hospital and some patients outside. Since we've opened up again, we are getting more patients coming into the hospital, and they are sicker than we saw them earlier.
सर, कोविड के स्प्रेड की जहाँ तक बात की जाए, एग्जैक्टली अगर देखा जाए कि हाउ इज़ कोविड स्प्रेड, कई जगह पे रिपोर्ट्स आ रही हैं दैट इट इज़ एन एयरबोर्न इन्फेक्शन। इस बात में कितनी सच्चाई है और आपकी रिसर्च क्या बताती है कि एग्जैक्टली कोविड स्प्रेड कैसे होता है?
जो आजकल है कि इट्स spread by droplets, so it's more of like flu, but there are some instances where it can be aerosolized. That means it can stay suspended in the air, and if you breathe in the droplet particles, you could potentially get it. The WHO doesn't want to agree with that at this point in time, but in the American health system, we are concerned that whenever we are doing procedures where we are giving a breathing treatment, जैसे हम nebulizer से किसी patient को breathing treatment दे रहे हैं या हम intubate कर रहे हैं किसी patient को, तो उससे वो उनकी जो airway secretions हैं वो सारी aerosolized हो जाती हैं और वो हवा में रहती हैं. उसकी वजह से anybody who inhales this is at risk for contracting the virus. It is spread through the respiratory route predominantly, and but is affecting multiple organs of the body, not just the lungs. So it is affecting the lungs, the kidneys, the nervous system, the heart, and it is also causing inflammation in the body, which is causing the body to go into shock and potentially shut down.
Dr. Amit, can you please tell us about the high risk groups? ऐसे कौन से लोग हैं जिनमें कोविड का रिस्क जो है वो ज़्यादा होगा, और अगर उनमें कोविड होगा तो उनमें कॉम्प्लिकेशंस का खतरा जो है वो भी ज़्यादा होगा? ऐसे पेशेंट्स के बारे में भी प्लीज़ हमें बता दीजिए.
The people who are at high risk are people of any age are at risk of contracting the disease. But the people who are going to get a more severe illness are the people who are over the age of 65, who have pre-existing conditions, and who also are overweight. So if they are the pre-existing conditions which it can occur are chronic kidney disease. अगर आपको किडनी की बीमारी है तो उससे हो जाता है. आपको COPD, फेफड़ों की बीमारी है. Anybody who's immunocompromised, जो दवाई लेते हैं अपने लिए immune system को suppress करने के लिए, if they are transplant patients or they are cancer patients, anybody who is overweight, and that is usually defined by a BMI greater than 30. So body mass index 30 से ज़्यादा है. अगर कोई सीरियस हार्ट कंडीशन है तब है. The other thing which is associated with sickle cell disease can cause it to be worse.
So what about patients who are on immunosuppressants? हमारी फैम हेल्थ की कम्युनिटी पे हमसे कई सारे यूज़र्स ने, हमारे मेंबर्स ने ये सवाल अक्सर पूछते हैं वो कि क्या हमको अपने इम्यूनोसप्रेसेंट्स बंद कर देने चाहिए क्योंकि उससे हमारी इम्यूनिटी कम हो रही है और हम ससेप्टेबल हैं टू कोविड. सो व्हाट इज़ योर टेक ऑन दैट? सो पेशेंट्स हु आर टेकिंग इम्यूनोसप्रेसेंट्स, हाउ शुड दे गो अबाउट इट?
They should continue all their medications. Any medications which they're taking for suppressing the immune system should be continued. If they get the disease, then it is a decision between them and their doctor about whether they need to stop the medications or continue the medications. So no medications which they're currently taking should be discontinued.
जी सर ये तो बात हुई इम्यूनोसप्रेसेंट्स की. अब बात करते हैं न्यूबलाइजेशन की. कई सारे पेशेंट्स हैं जिनको न्यूबलाइजेशन करनी पड़ती है अपने घरों में. अगर लोग होम न्यूबलाइजेशंस कर रहे हैं फॉर वेरियस लंग डिजीजेस, वेरियस लंग कंडीशंस, तो इस कोविड पैंडमिक के चलते उनको किन किन बातों का ध्यान रखना चाहिए? व्हाट आर द प्रिकॉशंस दैट दे शुड कीप इन माइंड व्हेन दे आर डूइंग नेबुलाइजेशंस एट होम?
They should continue taking the nebulizer for their asthma as prescribed by their physician. The only thing is because they are potentially aerosolizing, and if suppose they have the disease, they should do it in a separate room where nobody else is going to be coming in, and that they should wipe down the room, साफ कर देना चाहिए कमरा जहाँ वो है.
सर अब बात करते हैं उन लोगों के बारे में, उन पेशेंट्स के बारे में जिनको कोई प्री एग्जिस्टिंग मेडिकल कंडीशन है या जिनका इम्यून सिस्टम कॉम्प्रोमाइज्ड है. उन पेशेंट्स को जैसे जैसे लॉकडाउन खुल रहा है, अनलॉक हो रहा है इंडिया, तो लोग बाहर जा रहे हैं, लेकिन इन पेशेंट्स को किन किन बातों का ख्याल रखना चाहिए एंड व्हाट आर सम एसेंशियल प्रिकॉशंस दैट पीपल with a compromised immune system and pre-existing medical conditions, what precautions should they take?
The main precautions you can take to prevent this from occurring is stay away from people, unfortunately. So the more people you meet, the more chances of, if they potentially have it, is getting it. So you need to avoid people as much as, so if you're in lockdown, you need to stay in lockdown. And if you really need to go out, you should be wearing a mask. You should be washing your hands anytime you are bringing your hands to your mouth, nose, and eyes. So you should be washing your hands with soap and water for at least 20 seconds. 20 seconds ke liye, you need to wash your hands. So those are very important things for immunocompromised patients.
सर आपकी फैसिलिटी में, जिस सेंटर में आप काम करते हैं पेंसिल्वेनिया में, वहाँ आप पेशेंट्स को कैसे हैंडल कर रहे हैं एंड व्हाट आर द प्रोटोकॉल्स दैट योर हॉस्पिटल और योर फैसिलिटी इज़ फॉलोइंग टू हैंडल कोविड पेशेंट्स? प्लीज़ हमें उसके बारे में हमारे दर्शकों को बता दीजिए.
हमारे जो पेशेंट आते हैं, they are inpatients and outpatients. जो बाहर ओपीडी में आते हैं और ऑफिस में आते हैं, और जो दूसरे हैं जो इनपेशेंट्स हैं जिनको हम देख रहे हैं. So the protocol for any outpatient is that they are wearing a mask before they come in. They don't come in without a mask, and they are asked pertinent questions whether they were exposed to anybody with coronavirus, whether they have fever, chills, or sore throat, or cough, or muscle aches, loss of sense of smell and taste. So those are the screening questions which are asked before they can potentially come into the office. If they are positive for any of those questions, they're asked to go to the emergency room to be checked out. The patients who are inpatients, they're usually screened in the emergency rooms, but there are some patients who are not screened, so we do order the test and they're put in isolations, and we have to wear full personal protective equipment before we can go in to see them. So that means mask, shield covering the face, and gown and gloves.
डॉक्टर अमित, हमारे व्यूअर्स को ये भी बता दीजिए कि रिकरेंस के बारे में क्या रिपोर्ट्स आ रही हैं अमेरिका में, और एक पेशेंट को जब इन्फेक्शन हो जाता है तो री इन्फेक्शन की रेट्स क्या हैं या री इन्फेक्शन के चांसेस क्या हैं, और अगर री इन्फेक्शन हो गया तो रिकवरी कैसी होती है? सो टेल अस अ लिटिल बिट अबाउट री इन्फेक्शन एज वेल एज रिकरेंस.
As far as we know, yes, there is a potential that they can contract it again. Whether they will get a more severe case as compared to one they did earlier or not, we don't know. We had हमारे एक patient था जो he was persistently positive for 6 weeks. Then he finally turned negative. And then there's another case who had been tested earlier and was positive, and then had tested negative because they were going to go back to work, and they came in contact with somebody else who had coronavirus, and the patient got the coronavirus again. So they had to be quarantined, though not, they didn't get very symptomatic case, but they were positive when they were screened again. So they had to be quarantined for another 3 weeks before they could go back to work.
सर, कोविड का जो पैंडमिक है ऑब्वियसली एक अनप्रेसिडेंटेड पैंडमिक है, कभी इससे पहले हुआ नहीं है. आपके पास पिछले 2-3 महीनों से जो रिपोर्ट्स आ रही हैं उनसे आपको क्या what are your findings? Are there going to be any long-term complications in patients who have COVID, who survive COVID? उनमें किस तरह की complications होंगी? क्या ये complications सिर्फ lungs में limited होंगी, or will other organs be infected as well? Please shed some light on that.
Since it's a relatively new disease, we have patients who have survived. Unfortunately, there are patients who will develop, the patients who ended up with respiratory distress syndrome, who were on ventilators related to COVID-19, they will go on to develop some degree of loss in lung function, which may persist to up till a year or even sometimes more. Then there is going to be a lot of cognitive impairment on patients who have been on a ventilator for some time, as well as depression, anxiety, and post-traumatic stress disorder, as well as pain and physical deconditioning. So they're going to be weaker than they were. They're not going to be able to exercise. So if there was a healthy person who could, वो 5 मील साइकिल चला सकता था या 5 मील दौड़ सकता था, कोरोना के पास अगर उसको ARDS हुआ जब वो वेंटिलेटर पे था थोड़ी देर के लिए, तो he won't be able to potentially do what he could do before he acquired the disease for quite some time to come potentially. It depends on patient to patient. If it was a healthy young patient, there's a possibility that they can come back to complete normal after 6 months to a year. And if they were severely ill, I'm talking about just severely ill patients. Some of my patients, or what has been described, is that some patients develop the disease. They have, एक दो हफ्ते के लिए हुआ, they were sick, and there's some who are saying that it's persisting. They have fevers and they have sore throat, they have weakness, they can't do what they could. So I'm seeing some patients who unfortunately cannot go back to work, and they're coming to see if, because they are now being asked to wear a mask at work, and they are being told they don't feel comfortable wearing a mask, they can't breathe. So it's a tough situation.
सर, इट्स अ नोन फैक्ट कि इंडिया में एयर क्वालिटी जो है वो काफ़ी कॉम्प्रोमाइज्ड है. हमारा एयर क्वालिटी इंडेक्स जो है वो काफ़ी पुअर रेंज में रहता है. सर, आपकी फाइंडिंग्स के हिसाब से हैज़ देयर बीन अ कोरिलेशन बिटवीन पुअर एयर क्वालिटी इंडेक्स एंड कोविड-19? आर देयर एनी वर्सनिंग ऑफ सिम्टम्स? सो क्या कोई इक्वेशन है, क्या कोई कनेक्शन है एयर क्वालिटी और कोविड-19 के बीच में?
Air quality has been associated with a potential worsening of the disease. We are seeing a higher incidence of coronavirus in Allegheny County. Allegheny County, जहाँ Pittsburg में जहाँ मैं रहता हूँ, is used to be the worst air in the country. It's still the worst air in the country. Not as bad as Delhi, fortunately, but the mortality rate is higher as compared to the rest of the country. Our mortality rate is 7.5% as compared to other areas of the country. And there are multiple articles suggesting that worsening air pollution is associated with worse coronavirus disease. So the coronavirus did help in reducing the amount of pollution because everything was shut down. But now since everything's going back to reopening, so we're having more issues with that. So we're probably going to see people's lung health more affected more as compared to previously.
सर, कोविड की बात कर ही रहे हैं, तो ये सवाल आपसे पूछना काफ़ी पर्टिनेंट रहेगा कि मास्क्स के बारे में प्लीज़ शेड सम लाइट ऑन द इम्पॉर्टेंस ऑफ मास्क्स। कितना ज़रूरी है मास्क्स पहन के बाहर निकलना व्हेन वी वेंचर आउटडोर्स, एंड किस तरह की मास्क्स किन लोगों के लिए एडवाइजेबल है, और क्या क्या प्रिकॉशंस हमको लेनी चाहिए जब हम एक मास्क पहन रहे हैं। प्लीज़ टेल अस अ लिटिल बिट अबाउट दैट।
Unfortunately, the only thing which is preventative is wearing a mask. Everybody should wear a mask. So India एकदम सही कर रहा है कि बोल रहे हैं कि मास्क पहनिए। यहाँ का हवा का रुख ही कुछ अलग है, पॉलिटिशियंस का रुख अलग है, तो वो कमिट नहीं करना चाहते मास्क के लिए। बट wearing a mask is essential, especially for anybody going out or anybody who cannot social distance, meeting people more than 6 feet, and these people are not known to them. Everybody should be wearing a mask. The cloth masks are adequate for anybody who's not in the healthcare field. It will provide a basic protection. The other mask, surgical or medical mask, is for healthcare workers, and an N95 mask is also for healthcare workers. So because there's a shortage, we recommend that the regular person wear a cloth mask, including children. And anybody above the age of 2, is the CDC recommendation, should be wearing a cloth mask. These cloth masks can be potentially made at home, or people are making it and they're selling them. They usually should be 2-ply with something where you can tie and remove it and make it tight so it is covering the bridge of your nose and under your chin.
सर करंटली अगर आप हमको ये बता दें कि एट प्रेजेंट इन अमेरिका व्हाट आर द ट्रीटमेंट मोडालिटीज़ दैट आर बीइंग फॉलोड। जिन पेशेंट्स को कोविड-19 डायग्नोस हो जाता है उनको किस तरह की ट्रीटमेंट दी जाती है। प्लाज्मा थेरेपी के बारे में आपकी क्या राय है, एंड व्हाट अबाउट द वेरियस मेडिकेशंस, एंटीवायरल मेडिकेशंस जो कोविड-19 पेशेंट्स को दिए जाते हैं, उनके बारे में बताइए, और उनके आउटकम्स के बारे में भी अगर आप इफ़ यू कुड शेड सम लाइट ऑन दैट।
So initially when this happened, we did use, on some of those patients, we did use hydroxychloroquine and chloroquine, but we now are not using that. So we really don't know whether the medications helped or the patient was going to get better on its own and it was just supportive care. We have now started using convalescent plasma, and remdesivir is the other medication we're using. No medication has been approved. Remdesivir is the antiviral medication which has been approved by the FDA in an emergency use authorization, which is basically based on data which shows it shortens the length of stay in the hospital for people who have severe disease. So it is not shown that it is going to cure them or it is going to reduce their mortality. We don't have the data yet.
So the entire world right now is waiting for a vaccine. There are a lot of trials that are going on. So तो हम कब एक वैक्सीन एक्सपेक्ट कर सकते हैं, और वो वैक्सीन जो है वो कितना इफेक्टिव होगा इस पैंडमिक को कर्टेल करने में, लोगों को प्रोटेक्शन प्रोवाइड करने में अगेंस्ट द कोविड-19 वायरस। सर उसके बारे में प्लीज़ बता दीजिए।
According to the current state of affairs, there are about 140 vaccines being developed all over the world in various parts. America has got this, it's called Operation Warp Speed, based on Star Wars from our president. They're developing 5 firms which have been asked to develop a vaccine. The claim is that they're going to potentially have a vaccine either end of 2020 or early 2021. Whether the vaccine is going to be effective or not, and whether everybody's going to get it so we can get enough, the concept of herd immunity, we don't know.
सर मेरा अगला क्वेश्चन जो है वो एक ऐसा क्वेश्चन है जो हमको लोग बहुत पूछते हैं, और वो है इम्यूनिटी के बारे में। सर एज पर यू एंड एज पर मेडिकल साइंस, आर देयर सम ways by which we can boost our immunity? Are there certain supplements or medications which are available जिससे लोग अपनी इम्यूनिटी को बूस्ट कर सकें और कोविड के अगेंस्ट अपना इम्यून सिस्टम जो है उसको स्ट्रॉन्ग बना सके? व्हाट इज़ योर टेक ऑन दैट सर?
Personally, will not prescribe anything because there is not enough data. There's some suggestion that medications like zinc, which is used for the common cold, can potentially help. Then there is vitamin C, which is used for patients, has been used for patients who have respiratory disorders. There is no recommendation by any of the societies that they are successful, but they are being trialed. There's an IV vitamin C trial going on somewhere in Italy right now. The results are probably going to be available in September. There's a paper by somebody from India about turmeric, haldi, that it would be the magic drug to help with coronavirus. There is unfortunately, no data. But if you believe in it and it works for you, there is no harm in taking these over-the-counter supplements to see if they can help.
जी सर, rightfully said that if there are supplements out there, no harm in trying them out, along with taking safety precautions, जैसे आपने कहा, importance of mask, importance of hand hygiene and social distancing. सर, हमारे viewers जो आपको देख रहे हैं इंडिया में, उनके लिए आपके क्या, what will be your message for all the people who are watching you here in India?
Ask everybody to stay safe, wear a mask if they plan on going out. I would recommend our elders stay indoors and try and avoid people who they are not familiar with. And also, please keep on washing your hands.
Thanks a lot, sir, for taking out the time and talking to us at Fam Health. Hamare viewers, they are going to be immensely benefited by your words of wisdom, by your advice and your insights. Thank you so much, sir.